Okay, well, thank you folks for joining. We may have a few additional people coming into the call here, but we'll go ahead and get started just to be mindful of time. For anyone I haven't met, my name is Rochelle. I am the Government Relations Specialist here at the Wisconsin Primary Healthcare Association. We'll just spend a half hour or so together today. I'll give some background information, some resources, answer questions, and really, the intention of this call is to provide a connection to WIPGA, which is the statewide association for all of the community health centers in Wisconsin, give folks a heads up, and specifically folks being health center board members, a heads up about opportunities to engage in advocacy that are going to be in the next few months. And I know this can be just a new area of work or something that may seem unknown to folks. So this is really just a way to share that information. There are no needs for commitments today or any particular action steps. It's more of a way to tickle your interest in an issue and then let you know what's coming up so that you can make an informed decision of whether you'd like to be engaged in some of that work. Are there any questions for me before we get started, or logistics that anyone having a challenge seeing the slides or communicating during the webinar? Now is the time to let me know if so. Okay, well, wonderful. I do see we have some other health center staff and leadership joining, so happy to have you on the call as well. We will have plenty of time for discussion and questions, and these slides are available. I will send them to all participants after the webinar. So just as a quick background for you, again, WIPGA is the Wisconsin Primary Healthcare Association. I know you're very connected with the own health centers that you serve with on their boards, but for anyone that's not familiar, WIPGA is the statewide association for all of the community health centers in Wisconsin. We have our vision here, which is a future where all individuals and communities in Wisconsin achieve their highest health potential. And the way we do that is by providing training and technical assistance to the community health centers in the state. We do that through a lot of different formats. For example, we facilitate peer learning networks, which is a group of people with similar roles at different health centers across the state. So for example, we meet with the communication staff from each of the health centers as a group each month so they can learn about the work that each other is doing, maybe share strategies, share resources, scale work that they're doing across a region, answer and ask questions of each other. That all happens through our peer learning networks. We also look to develop strategic partnerships across the state, whether that is through training or through electronic health record work. And we do that again for all of the community health centers in the state, of which there are now 19. There were 2 new community health centers added in the end of 2022, which are not on the map, but just so that folks here on the call are familiar. One is called Rock River, which is between Madison and Milwaukee, and the other is Muslim Community Health Center, which is in the Milwaukee area. Part of our work here too at WIPGA is to advance bipartisan policy priorities with both state and federal lawmakers. And we work in 4 different areas, which include high quality care, health insurance coverage, workforce, and community health. So we are basically the association for all of these groups, and the CEO from each community health center makes up the WIPGA board. So we do really respond to the needs of community health centers in the state. And of course, the boards of each community health center itself, we engage with in lots of different ways throughout the year too, but we'll focus today's webinar specifically on engagement related to advocacy. So let me just stop here and see if there are any questions that I could answer or clarify for you at this point. All right, I'm surging onward then. Just so that you can recognize some faces if you ever see them on a future call or at an event. Our WIPGA team includes, I think, 18 or so staff, and we're based out of Madison and have folks in some other areas too. But from the team here today, I know myself as well as Sashi and Carly are on the call, and any of us are happy to help if there are questions that come up or if you need resources. Always feel free to reach out or flag us down. So I'll just start with a little overview on advocacy here. For health center board members, advocacy may or may not be something that you expected to engage in when you started serving on a health center board. But we have been trying to share a little bit more of this information recently, as there are some great opportunities that are coming up that we want you to be aware of. So some health center board members are already very engaged in advocacy work, and others may not be at all, or might be curious but haven't had an opportunity to engage. But a few reasons that you may want to engage, and that we see being true, are that it can be really powerful to hear from folks from a health center who are not actually paid staff. Often when we engage, it'll be a health center CEO or a medical director. And while their perspectives are extremely important, sometimes it can be really helpful to hear from someone who is in a volunteer perspective, because someone like a board member, whether you're a patient or a non-patient board member, kind of brings that additional importance to the conversation, knowing that you are giving your time freely and voluntarily to stand up for what that health center needs. And you may have a different perspective on that health center in terms of their broader role in the community, something that you bring as a board member. Also, we know that some health center board members do have existing relationships with policymakers or other community leaders, and tapping into that is something that we would love to do a little bit more of in partnership with you. A few of the common examples from health centers and their boards that get engaged in advocacy are here on the right. A great example of that I know a lot of health center boards do annually is to pass a resolution about advocacy, and that's just a way to bring advocacy front and center for the work of the health center. We do often provide trainings for board members, or come in maybe once a year to provide an overview of policy issues and what are the big topics coming up, either state or federally. And we're happy to do that anytime. So if you haven't seen me or my colleague Carly or Sashi at one of your board meetings in the last year, feel free to reach out, connect with your health center CEO or your board president and indicate that that's something that might be useful to you. Board members are also more than welcome to attend some of our big annual exciting events, which I will share more information with you about today, or participate in tours when policymakers come to visit. So for example, last week I was up in Watoma, where Family Health La Clinica, a community health center in the state, has a clinic. Senator Baldwin was visiting, and the board president joined that visit really to share their perspective on the needs of the community, which was really powerful. Board members could also engage, if you're comfortable with it, on kind of echoing the needs of the health center through the policymaking process. And if that's something that you're interested in, it can really be a great way to kind of be part of a collective. So when there is high priority legislation that WIPCA and the health centers are working on in the state, it can be really powerful to make a phone call or an email to echo that this is something you want to provide your support to as well. How WIPCA does our advocacy work, we really do this in a lot of different ways. Most of it is providing resources to health centers, and then part of my role too is really to deploy directly in the state capitol or with our members of Congress on particular policy issues that we've identified. So most of that is really relational. It's a highly kind of relationship-driven area of work that once you establish trust and have rapport, advocacy can be really powerful, but it takes investment to get to that point. It takes time, sitting down, having a conversation, asking questions, listening. But we do provide a lot of tools and resources to help make that happen. And all of that is leading to really telling the story of community health centers and patients that you serve across the state, and helping to develop laws or regulations that positively benefit community health centers and patients. That's really the big picture, what we're trying to work toward. Some of that is, as I noted, quite long-term. It can take years to get to those points. Here are some examples of where advocacy has been effective in the last few years, because I think sometimes people worry, does any of this matter? Is it important? And I got to tell you, yes. So for example, and pardon my pet there, hopefully she won't interrupt us too much today, but thank you for your patience. Some collective sustained advocacy has resulted in a few examples here. One is increased health center funding for health centers. So there's actually some state funding that health centers receive that is very flexible. It can be used for a lot of different programs or workforce initiatives. And we successfully were able to advocate for $1 million increase in that funding last year in the state budget, which goes through this formal policy process every 2 years. Another great example is advocating against legislation that would be problematic. So for example, there were some proposals related to Medicaid, which is the state insurance program that a lot of health center patients are covered by, that would have ended coverage or made it a little bit more difficult for people to access coverage. And through advocacy, we work with the governor's office to veto that legislation. We also see wins related to regulatory changes or just increasing the awareness of an issue. So often I speak with state policymakers who are not aware that there are gaps in access to preventative dental care for people in rural Wisconsin. So really letting them know that there's a challenge is very important so that once we have some solutions created together, people are interested in advancing those as a group. So even if we don't always have the exact solution in mind, helping the policymakers know that there's a problem is also important. Some people, these are just some sort of FAQs that come up frequently. So people want to know if nonprofits can do advocacy work. The answer is yes. You just can't do it all the time, or there are kind of particular restrictions on how much time you can spend doing it. But we'll always kind of keep folks apprised if you're doing too much. But it is certainly great to do, and especially when we can consider it educational advocacy, sharing information about impacts is more than welcome. There's no limits on that. Health centers also sometimes get involved with voter registration, which is sort of related to the advocacy work, and that is a permitted activity too. There are some prohibited activities, so neither health centers nor WIPCA could do any of these things. So for example, when you're speaking with legislators, you wouldn't be able to, in your role as a health center or in your role wearing your hat as a board member, separate from a private citizen, you would not be able to endorse a candidate, but you would be able to have a discussion with someone and let them know what they're working on and how that impacts health centers. Can't also use health center resources to encourage people to vote for particular candidates. And in terms of lobbying and advocacy work, federal funds cannot be used for that work either. So for example, if we were sending people to lobby on behalf of a bill, you wouldn't be able to use your Section 330 health center funding to support that work. This looks different in every setting that health centers work in, but here are a few examples of how that advocacy can be deployed. I mentioned a few of them already, so it could be a phone call or an email reaching out on legislation. WIPCA, and part of my role is to really manage what are the regulations or the legislation that's working through the process that is important for us to engage in. We would provide talking points and email templates and data to support that work. You don't need to be kind of grasping at straws to figure out what is important to talk about. We also have health center folks that could include board members come to testify at hearings, whether that's on a particular bill or throughout the budget session, which is basically starting now throughout the rest of the spring. There are wonderful opportunities to engage with policymakers. For example, up in Lake Superior last week, the governor visited and had a listening session where I know a board member and a health center staff person just went to talk about the work that their community health center is doing, kind of get that in front of policymakers. We also engage with both state and state legislators and members of Congress just in meetings. We try to do this at least every year where we go in and visit them and talk about the work that you're doing and any challenges that you've found. These are some of the examples. And as I noted, we take a bipartisan approach to this work. And I think that's important to note, especially as there's a lot of contention in politics these days. We want you all to know that we're not going to put you in the middle of that. We try to work on issues that have support from both sides of the aisle, that are opportunities for engagement, that aren't going to put someone in a tricky position. And we try to bring all of that work back to the mission of community health centers and keep that as connected as possible. We also love to tell a lot of stories. Those can be highly impactful And your experiences as board members are part of those stories we want to tell that really paint a picture. I'm our registered lobbyist, so I can go in and all day till I'm blue in the face talk about the work of health centers. But when it's someone who is on site there working through challenging issues, trying to make decisions about the strategic priorities of a health center, those can be really high impact opportunities. We haven't paused for at least a few minutes, so let me stop here. Yes, Leanne, did you have a question there?
I did.
Wonderful.
So the stories, agreed. I think they can be really impactful. I'm just wondering about like a youth, so would there be a permission slip a parent could sign so a teenager could talk about the PATH program they've experienced, or being able to go to the dentist and not having to drive to Milwaukee and miss school, or
oh, wow.
something like that?
Oh, Leanne, I love that question. I don't know how proactively health centers have engaged with youth in the past for advocacy purposes, but it's something that I would really love to talk with a little bit more. It can be sometimes kind of, it's usually during the work day, so probably during a student's school time, but we could certainly think about that a little bit further. And if there are youth that are interested in telling their stories, working with a parent or guardian and the folks at the health center to figure out what that would look like is something that would totally be on the menu of options.
Okay, and I know, a lot of them make videos already, so
that's true.
I'm sure we could get them to make a couple videos and share that.
Yeah, I appreciate that note. I think it's, I'm going to write that down for our team to think a little bit further about, but if there are youth who receive services at health centers that you think have an interest in this work, we would love to be connected to figure out how to echo that a little bit more.
Okay, sounds
good.
Thanks
for the question.
Mm-hmm.
Anything else that I should address as I'm rolling along here? Certainly, if you have a question, you're welcome to put it in the chat if you'd like, or just take yourself off mute. Okay. These are a few of the significant events that we host either annually or sometimes every other year. A few that I will just make note of for each of you are that we have a State Policy and Issues Forum coming up in late March. And the way that event looks is essentially visits with policymakers at the state capitol here in Madison. So we provide training the day of, as well as in advance virtually via Zoom like this, so that folks have an idea of what we want to talk about and tips and tricks for engaging in these legislator meetings. That is a really fun event that we have not done in person for several years now because of COVID. So we will be really excited, and oftentimes board members, and maybe this is even an opportunity for maybe a high school student to come for a morning or something if they're interested in doing it, to come in and talk with lawmakers. We do also hold events during National Health Center Week, which is August of each year. And usually those events are fun things that the health center is doing, a great opportunity for board members to be involved. Mentioned a few of these already, but the last one that I'll note is that there is an event that our national association, NAC, holds annually in Washington, D.C. that I know sometimes board members attend as well. Those are visits with members of Congress or their staff, which also includes training. It's kind of like the federal version of the thing that we'll be doing on March 22nd. So that is also a great opportunity, not only to engage with policymakers, but to really feel part of the movement. Sometimes we kind of get narrowed in on just our little health center and here's what we're doing and here's kind of blinders on, but it's a reminder of the powerful role of health centers and advocates all together when hundreds of people get together in DC. And if any of these opportunities are something you'd like to learn more about, you will see a link from me in our follow-up here with some registration information. Here are a few examples of advocacy in practice. So this is in the Capitol providing testimony at a hearing. This is some folks from 16th Street and Progressive and Access here in Madison, providing testimony about the state funding that supports community health centers across the state. And again, these are opportunities that board members could be a part of if you have an interest in doing that. I know it's not everyone's cup of tea, but it can be a very powerful perspective coming from a board member. Here was just that visit I noted last week where this is the health center board president visiting with Tammy Baldwin, just talking about why they serve on the board, how they got involved, and that was a great conversation. These are a few of sort of the spectrum of advocacy. Some people would like to be really involved, and some people just kind of want to know what's going on, but maybe not take action. So here are a few examples of all of that. I note those events coming up on the right-hand side of the perspective. But what we might want to provide opportunities for doing a little bit more often with board members who are interested is whenever we're trying to rally up support for some legislation in the state. For example, something that we're working on now is authorizing a new dental care provider to practice. If we hear from more than one person on that issue for a legislator, can help echo that this is something that is important to their constituents in their district. And we can provide all of the tools to know, if you're not even familiar with who your legislator is right now, we can make sure to change that. Just so you're kind of very high level aware of what some of the public policy issues are that we're working on. Any of these that you would like more information about, let me know. But on the right hand side of the screen there, you can see that we've got a document with our state policy priorities. For example, I mentioned that we're looking at that new dental provider type called a dental therapist. And just as you mentioned, Leanne, sometimes folks have to travel a great distance for preventative dental care. We feel strongly, and we're working with a coalition of folks in the state, that if we were to authorize this new type of provider to practice in Wisconsin, that it would improve some of those oral health access issues. So these are just some of the examples of things we work on. There is no need to be a subject matter expert in any of this or to have every little last detail about how a bill becomes a law. Those are all things that are part of my role to help you do and provide the information you need to be successful. So hopefully it doesn't feel too daunting, but I know that it can be if you don't do it every day or if it's new to you. In the state budget, we will look for a few issues to be funded as well. And as we get into the state budget process, if you are interested in advocacy, these are some of the things we might be talking about. So for example, the top one there that I'll note for you, we want to work with the state to help provide more resources so that high school students can get engaged and aware of different health professions. That's an example of a funding priority that we are working on right now. These are the federal issues at the national level that we're working on, just to kind of let you know what to expect. For example, there is a funding cliff in later this year for federal funding for the Section 330 program that funds community health centers. That funding will expire unless Congress takes action to increase it or to continue it. So we will be advocating pretty aggressively throughout the spring and summer about that health center funding. Another issue that your health center has probably brought to the attention of the board is funding and implementation of the 340B drug pricing program. This is a program that provides affordable medications to un- and underinsured patients, as well as helps health centers drive some revenue through the program as well. And there have been a lot of attacks from drug manufacturers on this program, so we'll be looking for a policy solution to address some of that. Telehealth is always a big topic at both the federal and state level, and something that we speak with a lot about policymakers. So I know that there are some opportunities coming up. They are both in March, in case you want to do the in-person stuff with us that's coming up. The first one is the event that NAC, the national entity, plans in Washington, D.C. That will take place on March 8th through 10th. And the visits on the Capitol Hill are taking place on Thursday, March 9th. Some board members do fly out to DC, for example, with a CEO or someone from the C-suite leadership team at the health center to do those visits with legislators and or participate in conference activities the rest of that week. The issue that WIPCA, or the event that WIPCA runs, is later in the month. That's that March 22nd date, and that'll take place in Madison. And basically, I will set up meetings with a lot of policymakers, state legislators and their staff, and then deploy teams of health center people to go do those visits together. So it would be usually a group of 2 or 3 people from your health center who is going to meet with the legislator, perhaps for about a half hour, and talk about a few of the policy priorities that we've identified and share the good work of your health center, make sure it's something that they're aware of. We do provide a lot of training, as I noted. All of that is, the training is all free and provided virtually, and then we'll do some day of at that state event itself. I also noted here at the bottom of the screen, there are opportunities to engage in the budget listening sessions coming up, and those are scattered around the state. So the governor will host listening sessions, and then one of the budget committees in the legislature will also host listening sessions. And those are events where people will either talk in small groups or go up in front of a crowd and provide information about issues they care about. That could be health related or roads or a million other things. But it's just a chance to get our issues in front of legislators. And again, we provide talking points and scripts and data and all of that to help that go smoothly. A few things that we do, as noted, we provide information about the legislators. We can schedule visits, share information on policy issues, provide that training, and handle follow-up. So I will stop at this point. I have been talking a lot and quickly for the last 27 minutes, and I'll just ask if there's anything else that you're wondering about that would be helpful as you're considering maybe getting a little bit involved in advocacy, or if you want to take a deep dive into it, that's great too. But is there anything else that's coming to mind for you that could be helpful in terms of tools, resources, or training as you think about perhaps getting a little bit more engaged in advocacy? I'd be delighted to know if something's coming up. Oh, and I see Carla is asking a question related to licensing of out-of-state behavioral health providers. I love that question, Carla. Yes, we are engaged on licensing issues for this legislative session. So I'm happy to talk with you further. That is one of our policy priorities for this year, kind of talking through licensing processes and making things a little bit easier for out-of-state providers. It's a hot topic these days. I'm glad you're paying attention to it too. Any other questions or resources coming to mind? All right, then I will just take us home here. I've got a few other slides here, questions that come up frequently. Do you need to be a policy expert? No, your expertise, especially as a board member, is just discussing why you're passionate about that community health center and the work that they do. You don't need to be an expert in every single little thing, but only in your own experience and in your work on the board. Sometimes there are tricky policy issues, or maybe a policymaker wants to go down a rabbit hole that's not super productive. We try to provide training for how to handle that, and also health center staff can be helpful about that in meetings. When we do these legislator meetings, they tend to be very friendly. Sometimes there's an exception to that, but usually policymakers really do care what their constituents, like you all, think and want to hear from you. So we try to provide those opportunities to make that easy. We also provide a lot of resources. So we give data and issue briefs and things that you can always leave behind in one of these meetings if people want more information. So if you are interested in anything that we've shared information about today, or if you have follow-up questions, you will see an email from me that has registration for these events. It would be a great idea, if you haven't already, to connect with your health center board president and the leadership team of the community health center whose board you serve on, to indicate that you'd like to get a little bit more involved with advocacy. We want to know that and make sure that we're communicating that with the health center leadership so that the left hand and the right hand kind of know what they're doing. If you have a specific area of interest where you're like, I really care about behavioral health licensing issues, for example, that is also something that I would love to know about so that we can get you tapped into perhaps opportunities to engage on that particular topic. We also want to know if you, for example, went to high school with Mark Pocan. That is something that I would love to know so that we can leverage any relationships that you already have. And I will just wrap up here. I do see a question in the chat related to Medicaid expansion. Carla, I will be happy to follow up with you about that in an email. We are in a weedsy topic at this point, so I will just circle back with you on that. Kim, appreciate your chat in the your comment in the chat as well, and I'll send some follow-up materials. Are there any other questions? I know we just had a half hour today. I wanted to run through a lot immediately, but are there any other questions or need for resources that folks have right now? Okay. Then I just want to thank you for your interest in